Now let's talk about stroke. Every 40 seconds, someone in the United States has a stroke. Stroke is a leading cause of serious long-term disability and the fifth leading cause of death. A stroke occurs when blood stops flowing to a part of the brain. This can happen if an artery in the brain is blocked, ischemic stroke, or a blood vessel bursts, hemorrhagic stroke. Brain cells begin to die within minutes without blood and oxygen. Treatment in the first hours after a stroke can reduce damage to the brain and improve recovery. Everyone should know warning signs of stroke. Use FAST or FAST method to recognize and remember the warning signs of the stroke. F is for face drooping. Ask the person to smile and observe if there is any asymmetry. A is for arm weakness. Is one arm weak or numb? Ask the person to raise both hands. S is for speech difficulty. Is speech slurred? Ask a simple sentence to repeat. And T is for time to phone 911. Other signs of stroke are sudden dizziness, trouble walking, or loss of balance or coordination. Sudden trouble seeing in one or both eyes. Sudden severe headache with no known cause. Sudden numbness of the face, arm, or leg. And sudden weakness in part of the body. And sudden confusion or trouble understanding others. What to do? Quickly evaluate the victim for signs of stroke. Activate the emergency response system or have someone else to do so. Find out what time the signs of stroke first appeared. Remain with the victim until someone with more advanced training arrives and takes over. If the victim becomes unresponsive and is not breathing normally or is only gasping, what to do? Give CPR. Again, here, brain is time. Time is very important. Drugs that break up a clot must be given within about 3 hours after the time the signs first started. During the evaluation, you will always hear that providers, professional doctors, they ask and they must know the last known well time. This is the point at which the patient was last known to be well without signs of stroke. And the gold standard treatment for ischemic stroke is an intravenous administration of alteplase. This should be given within about 3 hours after the time the signs first started. Another option is thrombectomy, an invasive procedure that removes the clot from inside the blood vessel or the artery. And let's repeat one more time. Priorities are early recognition, limited scene time, and transfer to the appropriate facility.